Hi class, my name is Erna. For this week discussion on presentation of community plan, I will be talking about my community, Round Lake, Illinois, and I'll also talk about my community project that I carried out at Oak Hill Supportive Living in Round Lake, and I'll talk about the community diagnosis, and I'll also talk about my objective and my goals and both the short term and the long term goal. I'll also talk about the evaluation and how these objectives were being met and the different stuff things I did during my community project. For So we'll begin by defining what community assessment is. Community assessment, according to CDC, is a state, tribal, local, or territorial health assessment that identifies key health needs, issues, and through systematic and systemic and comprehensive data collection and analysis. So what that simply means is, as a healthcare worker, I'm supposed to know about my community. I'm supposed to know how and the different ethnic groups in my community and the different diseases that people in the community are prone of having, and the income level, the standard of living, the poverty rate. This will enable me to be able to um deal with and understand my patients during my community care, and is also going to help me to deliver services effectively. And my community project at Oak Hill Supportive Living. Before diving into that, I will talk a little bit about my community, which is Round Lake, Illinois. It is located in the state of Illinois. It is in the northern suburbs of Illinois. It is one of Lake County communities. It has many services that it offers. It has about 156 convenience stores. It has healthcare services. It has immediate care services. It also has um, assisted living, rehab centers, and according to um, according to the Lake County, website, the it has different diseases that the population of the community are prone to. I'll talk about my Round Lake community has libraries that it offers book club for children. It also offers nutritional health programs and classes. It also offers teen trivias. The Round Lake community commute is about 30 minutes drive. Most people in the Round Lake community do use their cars, vehicles, and very few people use buses and trains. The Round Lake community has about 174 convenience stores that has gas station. The Round Lake community also has high schools which has about 171 students according to citydata.com website. The Round Lake community is considered safe according to the Data USA website, which is about 62% when compared to the city state's violent and property crime rate. The Round Lake community offers child care services. It also offers senior services such as assisted living and rehab centers and nursing homes. One of the assisted living senior centers is Oak Hill Supportive Living, where I did my community project at. Um, my community assessment, this simply talked about the different racial groups and ethnic groups are found in the community. The majority of the racial population in the community is made out of white, non-Hispanic population. They make up about 50% of the population, while 19.5 percent of the population is made out of non of white Hispanic. According to Data USA, about 0.1% of the population is made out of American Indians, and 9.03% is made out of African Americans or Black. The Round Lake population has about according to data.usa website, it has 1.49 thousand out of 18.3 thousand people living below poverty line when compared to the state. That is a little too much. And the main ethnic group made living below poverty line is the white race. Um, According to the Lake County community, the prevailing diseases in the community is cancer, obesity, heart disease. Surprisingly, in the year 2020, 2021, the number one cause of death was not COVID-19, it was heart disease, and COVID-19 made came number three cause of death among the Lake County population. I'll dive into my community project. Um, Before that, yeah, we have a table that shows the standard of living. The Round Lake community has about 7% higher in the standard of living compared to the national average. The utility bills is about 7% lower than the national average. The community partners. So in my community project, I partnered with Jennifer Rollins. She's the supervisor to the nurses. Her job title is called the resident care manager. She simply takes care of the residents and their issues and make sure they're happy and anything that has to do with the residents. And she also supervises the staff. She helped me in my community project by assigning me to a nurse, and she made sure I report to her every time I come in, and she asks me questions regarding my teaching and make sure that I work hand in glove with the Viva Life coordinator, which is Jolie Martinez. So I worked with Jolie. She made sure she put my name on the community calendar and the times in which I'll be available to talk with the residents, and she made sure the programs were being put up during the day in which I'm coming, and the residents are available during my teaching. She was a very great partner. She also made sure that the CNAs assisted in bringing and reminding the residents to come down for the teaching session. One of the resources that I found very, very useful was the American Heart Association. From there I got many materials that I use in my presentation for my teaching on high blood pressure. It gave me different resources which such as the different type of blood pressure, and I got short videos also from there. Apart from the American Heart Association website, I also used the CNA as a resource. They were good in bringing down the residents for the teaching. They also helped in helping me in measuring, in taking blood pressure during my teaching, and make sure that they report the different abnormal blood pressure readings to the nurse as well. And also they made me understand the different um cognitive level of the different residents. My community diagnosis was the risks of ineffective health management among Lake County elderly. Round Lake elderly related to lack of knowledge of cardiac disease process as evidenced by continued elevated blood pressure and non-compliant with diet. In order for me to do to in order for me to be able to carry the project, I came out with questionnaires which simply gave me an idea on the diets in which the residents were currently their baseline. It talked about those. I have it attached in appendix 1 and 2. I also had videos that I talked about it as well. The diverse community, the my community plan. During this period, I talked about how to maintain blood pressure readings below, to maintain blood pressure readings, and I talked about the different type of blood pressure, the diet, and all that, and the patients. I just showed different dose. So my main objectives were to give the resident an understanding or an management of their hypertension and describe the therapeutic action within 2 days, and to maintain a blood pressure reading within an individual acceptable parameters, and also to have show changes in their eating habits and maintain a healthy weight within 3 weeks of my teaching. And some of these objectives were met, like the maintaining of their blood pressure and exercising, and also stop bad habits, but some of them were not met. um some of the interventions that I took was also to make sure that I educated them on the risk factors that would lead to elevated blood pressure. I also educated them on the modifiable risk factors that can increase your blood pressure, like smoking, alcohol intake, obesity, also how to change just lifestyle to make sure their blood pressure is within acceptable range. um the purpose and the method that I use, I talked about the PowerPoint presentation. It can be seen in appendix 2. I talked about the questionnaires that I use in making sure that they understand, they have a baseline that I can work with. And also I also had them teach back after my presentation. I made them talk to me about the different ways in which they understood, and got feedback that showed that this was successful. Some of them telling me how they've been exercising and they're coming down for yoga classes. Others told me how they've improved their lifestyle by stopping to add more salt onto their diet. So in conclusion, I could say that the community project was a success, because out of the two short-term goals and one long-term goal that I had, the two short-term goals were met, but the long-term goal wasn't met. I think changing lifestyle and making sure that their weight are maintained with the continue not adding extra salt and diet, and continue exercising, the long term goal will eventually be met. Thank you all for listening. I have more resources down here from the appendix. These are the videos that I used in presenting to my residents during my teaching. You can go through them, and they were very enriching, and they helped the residents, and the residents did verbalize that the different teaching were simple things that they knew they had to do, but they did not they find it difficult doing. Thank you all for listening, and have a good day.